Well, welcome everyone. We are really excited because today we have Dr. Sridhar here with us. Hello, Doctor.
Hi.
Giving you a little bit about him and why we're so excited to have him is he is a pediatric neonatologist that has a MRCPCH, which means that he has degree and status from the Royal College of Pediatric and Child Health in the UK. He's the head of neonatology at Al Zahra Hospital in Dubai. He completed his basic medical training from India in 1995 as the best outgoing student from Stanley Medical College in Chennai. Qualified for pediatrics and neonatology in India and completed his membership of the Royal College of Pediatrics and Child Health in the UK. He obtained entry into General Medical Council Specialist Register in the UK and obtained his fellowship in 2006. He worked as a specialist registrar in neonatology and from 2005 until 2012 worked as consultant neonatologist in level 3 neonatology at the Wishaw General Hospital, Moscow. Okay. So he's traveled around a bit and be sure he understands that no matter where you go, children's brains are the same, right? He moved to Dubai and works there as a consultant as a neonatologist and head of the department in 2017. After a short stint at Al Ain Hospital, he worked as a consultant and head of the department at Zulaikha Hospital in Dubai till October 2020, where now he has moved to Al Zahra Hospital, sorry if I got that one wrong, as head of neonatology. He is an examiner now for the MRCPCH examinations since 2010 and is an instructor as well. So now he helps teach others to become as proficient in what they do as he does, and wonderful person under. His special interest includes neo development, respiratory support, and as I understand, expert in whistling. He has many peer-reviewed publications, and he puts up some awesome videos for us to watch and learn a little bit about important things regarding our children's health. So questioning him today, I'm not going to be questioning today. I'm going to be listening and getting those questions that you post, and we do encourage you to ask them. And we're going to introduce Atul, our fearless leader, the early childhood mastermind community. We are all thankful for him for having the vision to start this wonderful group. We are now up to over 12,000 members last time I looked. Atul himself has opened over 150 schools in the 20 different states of India, and he himself has won over 20 prestigious national. So without taking any further time away from us obtaining this awesome information today, turn it over to you, Atul.
Thank you so much, Maryann. Thank you so much. And I welcome Dr. Sridhar to the Spotlight Show. We've been looking forward to finding a doctor to speak to us, especially related to, impact of COVID on small children. So thank you so much, doctor, for having joined, and let me bring you to the spotlight here. So doctor, we start with the very generic question on which everybody wants to know. There's so much of information and news regarding the impact of COVID on adults, as we were just speaking, but there's very less information and less information and talks on the impact of COVID on small children. Small children means for us 1 to 5 year old. So what do you say that is COVID harmful for toddlers? And what are the precautions that parents should take during this time, especially with small children? Now, this is a very, very important question that everybody wants to know. I'm sure they're waiting for this answer, and which we want to hear you, because you are a pediatrician and you've been already uh, giving a lot of information to your, I think, patients and everybody in your neighborhood and everywhere, you wherever you are working. So over to you, doctor.
Thank you. Thank you, Atul, first for inviting me, and thank you, Maryann, for the very kind introduction. You have got an amazing team and an amazing show, and I'm sure this will be very useful to all of you. In terms of this topic, it's very, very important topic now, especially with the second wave happening in most countries around the world. And as you rightly said, I mean, I have trained in India as well as UK, and I've been working in the Middle East. I worked in India as well. So I have a fair understanding of what is happening in different places around the world in terms of children being affected. COVID has been here since, end of 2019, and as we know it from early March 2020. And it is here to stay for some time, unfortunately. I'm sure we'll be discussing that in detail. But in terms of impact on children, so first of all, no one is immune fully from COVID. Children are affected as well, but the good news is that children are less severely affected for various reasons. I mean, one is that their immune system reacts differently. The receptors on the airways through which the virus gets into our system is less prevalent in babies, the angiotensin converting enzyme receptors, so to speak. As I said, the immunity is relatively naive. The balance of the immune system is different. So we don't react as much with the cytotoxic storm, which is the main reason why our own immune system attacks us in adults when they get exposed to this new virus. And children in general are far more exposed to viruses in their routine. Like you mentioned, you have 150 nurseries, so all of them have plenty of viruses, unfortunately. So that's part of the childhood life, and they are exposed through other children to the common cold. And one of the causes of common cold is not this coronavirus, but different coronaviruses which can be associated, and different viruses like rhinovirus, adenovirus. So they're kind of routinely in touch with viral infection, so they react differently. So that's the reason why children have less severity. However, that wouldn't mean that they don't get unwell. If you look at the CDC statistics, for example, I mean, 13% of the COVID patients in the US are children, even though children contribute to 22% of the population. So it's a relatively lower number. That could be because they are not going out much, and the schools have been closed for some time, and the testing in children is less significant. So children do catch the infection, and they do harbor the infection possibly for shorter time because of the way they handle the infection. So, but they do spread it to others in the family. So precautions are essential. The severity of the infection in children may be milder, but they may spread it to other at-risk adults. And as the vaccination progresses, hopefully that will be less of a concern as well. There is one important factor that has come up recently, not exactly in the age group you described, but in a slightly older age group from 7 to 12 years of age. That is a post-inflammatory syndrome and post-infection inflammatory syndrome, or a multi-system inflammatory syndrome related to the coronavirus. We call it PIMS or MIS. And that has been reported since April 2020, where the children react with, after 2 to 3 weeks of the initial infection, which may or may not be symptomatic, they then develop high fever. They may develop a shock-like presentation where they get low blood pressure. They may have involvement of the heart. It may involve the lungs differently. And so it can be a serious problem needing intensive care, and we treat it with immunoglobulin and other treatment as well. So this is one thing that the parents should be aware of, that even though they're asymptomatic in the initial period, a small number of them, it's not a big number. In a country like US, for example, they've seen a few thousands when you have 1.3 million children who have been infected. So it's not a big number, but you have to keep that in mind. And there is another long COVID syndrome, which all of you might have been hearing as well, where after you recover from either a symptomatic infection or even asymptomatic infection, you have things like chronic fatigue. For example, your ability to perform has been limited in multiple ways. This happens in adults mainly, but there have been reports of adolescents and even older kids being affected. The younger kids probably don't express it as much. More important than the clinical involvement of COVID is the socio-economic involvement and the impact on the schools, which will be the mainstay of our discussion today. As for the parents, how they handle children. Obviously, you have to follow the social guidelines. Different countries have set in different rules. However, the common principles that we all need to follow is social distancing at whatever cost, and wearing a mask where possible. So, more than 2 years of age, when you take the children out, let them wear a mask, and hand washing, hand hygiene, especially when you go outdoors. This is one area to stress, that when you are inside the home with your family, you don't need to keep washing your hands. It's when you get exposed, because many children come with eczema on their hands, dry skin, because they're overdoing the hand hygiene. So stress on the outside factor when you're exposed outside to other people. And same way with the mask in babies. You're not putting the mask on small babies because it can suffocate. When they try to remove it, they cannot remove on their own if they are blocking their breathing or anything. And if you do come across people when you go out with small kids, you can face them around when you have to have a discussion. Keep the 2-meter distance. You should be safe enough. So sensible approach, minimizing your outside trips as best as you can. At the same time, having a reasonable level of interaction. So I hope this answers your question. Do you have anything more to add on this?
Fantastic. I think fantastic. So just to sum up some things that I took from this conversation, that this answer, that children, they already have a strong immune system, which whatever, even if they catch infection, there's no need to worry. They will recover. You have to go to the doctor, and whatever medication the doctor says, you'll have to take it. But children they can spread the infection to adults, which is what we have to keep in mind. And to prevent everything, one needs to wear mask. Children above 2 years of age will need to wear mask, and will have to keep washing their hands, sanitizing, and not too much. Very importantly, as you said, that there may be some children who are coming when they have washed their hands and it has impacted their skin because they've done it too many times. So it has to be restricted whenever they go out. If they come in, the first thing that they should do is hand wash with soap and water properly, and that's it. You don't have to keep washing the hand when you are inside the house. So that is something that is very, very important, that doctor just told.
I'd just like to add something here, that you mentioned going to the doctor. Again, we can see the current situation in India is quite bad. We have huge numbers affected, and the healthcare system is already stretched. So remember that if you have someone in the family with COVID and your child has some fever, you can manage with symptomatic treatment like you would normally when a child has fever. Keep the child well hydrated, use paracetamol, symptomatic treatment for any symptoms they have. You don't need to panic. You don't need to rush them to the doctor unless they are a high-risk age group, like under 3 months, and if they have other healthcare related problems like asthma or other concerns. So if they are breathing comfortably, if they are eating normally, there is no vomiting or diarrhea that would cause dehydration, you can monitor them with symptomatic treatment at home. Don't expose them to healthcare systems unnecessarily. There is no need to test also. If you have someone positive in the family, you can assume that they have positivity. And obviously, I told you about the long-term complications which you may have to keep an eye for, and keep an eye for oxygenation, as we have. So many people are aware of pulse oximetry at home now. And you can consider monitoring them temperature-wise, vital signs-wise on the pulse oximeter as you can. So you don't necessarily need to go to the doctor.
Fantastic. I think that's a very important point which doctor has suggested to all the parents, that whatever information that is, if it's a normal fever, they can give the medicine that doctor usually gives on fever and cough or cold. But if they have some severe infection, if they have some breathing problem, only then you consult. And it's very right at this point of time when the healthcare system is jacked up big time and there are queues building up for wanting to just get a bed. It's not right to actually take small children to the hospital. All right, that's great. So Dr. Sridhar, beyond the impact of the COVID infection, there's something beyond which I want to have a discussion, and I want your views, that what is the impact of children, especially the age group of 1 to 5 year old, because the schools are closed and kids are at home mostly. Okay, so what are the harmful effects, or what is the impact of that? Whether they should be continued to be kept inside the house, or what is your feeling, or what have you heard? I'm sure you must be getting some kind of responses from parents and whatever. So
it's a very important
what is
question. Yeah, thank you for raising that. I mean, obviously,
because
the
see, we are
crisis
talking
of
about the infection, nobody is talking about the psychological or social and emotional health of the child. That's something that
yes,
only we know, because that is what we focus when the children come together, in a nursery or a pre-primary or primary school. But the schools have been closed for last 1 year, and it doesn't look like that they will open very soon. So
yes. I mean,
what
this is a
is yeah.
very important question, and obviously, it's quite a grim picture overall. The impact on the child is not just from what happens to the child himself, and you also have to look at the family environment. So this pandemic has been a big hit in so many ways to the parents of the kids as well. So many people have lost their livelihood, and if they do have a job, their work pattern has changed. Their working hours are not limited anymore. There is a huge threat to their job security. So they have tension in the background. They're not really their normal selves. And on top of that, economy has crashed in many places. So the flow of money, if you are a businessman, for example, the business isn't happening as well because people are not willing to spend money. They are holding on. If you are in the travel or tourism industry, it has been hit hugely as well. So you should remember that behind these people is their family. I mean, whoever is suffering. The UNICEF has put out data that uh, children at risk of poverty-related problems, that proportion has increased of almost 20%. And we are talking of a global pandemic impact on children all over the world. We will focus on children in India, for example, now. And the crucial part is they have siblings. The 1 to 5 year olds mostly have older kids who are going to school before, who are not going to school. The responsibility of the parents lies not only on these children but also on the older kids' education. So it's easily said that online learning is happening as a replacement, but is it a real replacement? And are the parents able to do justice? Is it fair on the parents to expect them to do justice? And thankfully, I'm living in Dubai, where the government has been really visionary in the way they have led this program. And actually, we were among the first to reopen schools. I mean, many countries were debating whether to reopen schools, and my children did online learning for the first 3 months of the lockdown. And then when the schools reopened, they went for mixed pattern of learning. They gave the parents the option of whether they want to go in person and whether they want to come. And they also gave the hybrid option. The reason the hybrid option was given was because of these 2-meter restrictions. The classroom could not function to the full size. And I'm very happy to tell you that this applied even to the nurseries. So the preschools did open with restrictions. They have limited numbers. And recently, in the past few days, I've seen parents who said that this nursery have opened full-fledged. So obviously, it has restricted, but things are opening back. And for that, you need the brave leadership. And here, the vaccination push has been so remarkable that almost 60% of the population has received vaccines already, and they are targeting 80 to 90% to receive the vaccine. So they have planned ahead. The shortages are not affected because they have 2 or 3 vaccines in the pipeline, and one going down, they bring the other one. So they have been really open. Initially started with Pfizer vaccine and the Sinopharm vaccine, then they brought in the AstraZeneca vaccine, and now they have the Sputnik vaccine as well. So this is an example of how you can organize things. And obviously the reason they have not closed down is the impact on children of these lack of education or proper education. When we talk of online platforms for young kids, obviously it's a huge task. I mean, it has suddenly. We don't know how long this will continue, and so people haven't really been thinking about the impact. But now we know that this is here to stay for another year or so at least. So we should plan, and even for the future, I think we should be considering a hybrid pattern, because you have benefits of online learning, you have benefits of physical learning. And so when we are preparing to do more online learning in a suitable way for the kids, we should start thinking in futuristic ways of a hybrid pattern. And even now, once the second peak ends, hopefully schools will reopen, at least with restrictions. And I think in India they were reopening schools briefly, but now this will hit them and the exams have been cancelled and so on. And so we have to wait some more time, possibly a few months before we can see that. But planning is important. We have to look at, I mean, we have educators like Maryann on the show now, and we need to understand behind depend the age. And I mean, you're mentioning about my educational YouTube channel. So one of the last videos on the channel was about, it is an appeal to teachers basically not to assess children who are young, less than 6 years. Our aim is not to assess them, it's to assess them from their potential perspective and support them and guide them. We are not giving them a report card. So this is a very important concept that we need to understand. We have to support the parents as well, because they are handling different children. They are handling a job which is dangling by a thread. They cannot really put in as much effort as the teachers might expect them. We have to come out of the previous curriculum model. We have to devise something which is essential for the children to learn. So we shouldn't focus on the things which are not as essential, the superfluous. This applies not only to the preschool kids, it applies to the older kids as well. And when we say hybrid model, when we start thinking of a hybrid model, the family in focus, we should focus on socio-emotional skills of the young kids. So when we talk of social emotional actions, the only relevant part that they need to attend on a physical basis, on a timed basis, is where they interact with other children, where they have a play date online, for example. You can devise techniques where the children are actually interacting. So it's easier to make them attend to the screen when you're actually doing something, your ears are involved, you're talking yourself, you're not listening to the teacher. So that kind of learning has to take a back seat. And I was speaking to Atul just before the show, and we had a chat on how a recorded version can be given to the parents. It's a brilliant idea, because even doctors now, we have medical learning, and that's mostly happening out of hours when we want, because now the conferences are happening as webinars. They're recorded, they're posted as individual things, and we can see them as we want when we have our free time. So the parent has 1 or 2 hours per day that then their child. This time could be staggered between different children. So if you have 2 or 3 children, for example, in the family, you could stagger the time that they have to sit physically for the younger child, say 11 to 12, and for the older kids after that. Then they have the time to catch up on the recorded lessons, and they could have some form of homework, but no severe forms of homework time. So we should have a sympathetic approach to both the family and build a partnership with the parents. We should clearly indicate to them the goal that we need to do, what they need to achieve, and not have unrealistic goals. And we should understand the psychological impact of what's going through in the parents' mind on the children as well. Because if the parents are depressed, if they are irritable, their reaction to the child is going to be different. The teachers have a responsibility to limit what they need to expect from the child to what can be realistically achieved in the home environment. And there are 2 important requests I would like to make to the educationists and the coordinators of education, like Atul and the owners of these groups. So the main thing is understand what the parents go through. Second point is what the child exactly needs, and realizing that limits of the social media and the online learning tools. And then whenever the government allows, whenever the earliest possible, we can start a restricted form, say twice a week, for part of the class that they actually meet, because the social emotional development from children involves 2 or 3 important aspects. One is communication skills. So peer-to-peer interaction is one of the key roles in communication skill. Developing patience, that is waiting for their turn. So a game where they pass the parcel, they're waiting for their turn. When a teacher is asking people to contribute in a group, they're waiting for their turn. This doesn't easily happen at home, because one of the key things at home is that the children take the parents for granted, while that doesn't happen in the out-of-home environment. So the teacher is able to form an environment for the child which is different from the school, with different from the home, so where the child is able to respond better. They have the limits of discipline set better. So it gives a respite to the family as well, who have been sitting and educating the children. It gives them some time. So it gives you a glimpse of what life could be without the pandemic. So I think the earliest we can, of course, parents are going to work in most situations where there is no lockdown. People are going to the shopping malls, people are going to the restaurants according to the local restrictions that is varying. So obviously, we have to be brave enough because this is a long-term problem. Vaccination should be focused as best as you can. Focus on everyone taking the vaccines. Don't listen to the rumor mills which try to avoid the people taking the vaccines. Vaccines are going to reduce the severity of the disease, and you may not get hospitalized. You may not die of the disease. Even if you do get the infection, you are less likely to transmit it to your family members. So I would encourage everyone who is in the vaccination age group to take the vaccines and focus on resuming as close to normal as possible by having some physical sessions. And that's where the educators have to plan. The online session should be staggered in a way that allows the parents not to constantly sit with the child. The child gets frustrated sitting 2-3 hours in front of the screen. They're not meant to be sitting. I'm an advocate against screen time for children. So it's unfortunate that we are in a situation where young kids have to watch the screen. So we have to, if at all you watch the screen, the parent should be with the child, and we should be realistic. A parent cannot sit with the child more than an hour or so. So we have to balance it. And this is just an introduction, and I request all the educators to think about it in a serious way, putting the parent's perspective in mind. For the child, they get agitated if they're not interacting, if they don't have an emotional exhaust, so to speak. And this school provides that. So physical school is important for the children. And the teachers are educated now in the social distancing, and having a restricted number, they can rotate the children. Like if you have 30 kids in a class, 15 of them can come the first day and the next 15 can come on the second day, and you have 6 days of the week. So all of them get 3 days in the class, and that's what is happening in Dubai as well. So I would encourage other governments to think of those, because the young kids' emotional development is very important, and these are areas where foundation is being laid for future life, future education, future behavior. So that's where we need to focus on.
I'd like to insert a question, if I may, Atul. As someone that does a lot of work with educating people that work with infant toddlers, I feel like they might be getting overlooked a little bit here, in that they, from what I have learned before, and Doctor, I'd like your input, is that from 0 to 5, the immune system is still developing. It's not as fully as strong yet as a child that is 6 or 7, and which is traditionally why schools started later, waiting for the immune systems to catch up. But so for children 3 and older, they've learned to basically sit still. 15 minutes at a time is about as much as they can handle, which is why you have to mix in. But for the parents that have the 1 and 2 year olds, and they are being called back to work, what can you say to alleviate their fear about taking that 1 or 2 year old child, putting them back in daycare?
I mean, in terms of precautions, all the daycare centers should take the precautions, and the children, even if they are infected, it behaves like a viral infection like they routinely have. I mean, one thing I would like to stress here is that after this pandemic started, the routine influenza and the other common cold illnesses have really disappeared. So I do some pediatric practice as well as being a neonatologist, and we hardly see the high-grade fevers we used to get. The inpatients department in pediatrics has really crashed, and pediatricians are also at risk of losing their livelihood in the current pandemic, because children stay well, which is a good thing, obviously, but how long this pattern will persist. And we were talking about the differences in the immune system, how it reacts differently in children compared to adults. And part of the reason is because they're exposed at regular stages to the other viruses. So how these children will behave when the pandemic ends and they face the normal viruses, we don't know. I mean, we might have a second wave of, say, a common cold, which is behaving differently after this pandemic ends, because we have kept it suppressed. It may mutate into something else. So hopefully not, but let's hope for the best. But for the parents who want to resume their normal, I mean, they have to choose the right place which has the proper precautions taken. You have to inspect the place. You have to make sure that the nursery or the preschool understands what the requirements are. They understand the importance of social distancing. And so it's very important that they select the right place. And I told you, this is there to stay. So we cannot be staying in a bubble or a shell for a very long time. We have to come out of the shell, but we have to take risks which are low. We shouldn't definitely throw ourselves into a party. We shouldn't have a lack of social distancing. We have to sensibly send the kids to the playground, for example. So when you're in open air, the risk of exposure to infection is much lower. It's 20 times less than if you are indoors. And children who are outdoors playing with other children in the open air, provided the other children do not have any symptoms, you can let them play together in sports like football, for example, or throwing a ball and catching it or running around. They are not going to sit around and play. If they are going to sit and play, if they are more than 2 years, you encourage them wearing a mask and social distancing should be maintained. But if they are outdoors playing a sport which doesn't involve direct physical contact, they are welcome to play without the mask. This applies to even adults who are going to have physical, because physical health is going to take a toll. And we discussed music as a therapy as well. I mean, educating them in a fun way is what I mentioned. When you do the 1 to 2 hour of online learning with these young children, you have to catch their attention so the parents are not stressed about having to make them attend, which is not really possible.
Yes.
And unless they are actively involved, they are not going to learn anything. So your aim is not to just make them sit there and tick a box that they attended. Your aim is to make sure that they are interacting, they are attending. So having interactive sessions which are musical is a great idea. Having fun sessions, I mean, again, you have to think of tools which the parents will have in their family. So they could have something like sugar, for example, or they could have some cooking things which are safe to use. And we could make shapes out of it. You could have Play-Doh based games. You could have form board based games. You could have jigsaws with the children make, which most families might have a jigsaw at home as well. And music sessions are obviously going to educate them in an interactive way. And this is the kind of thing they see their peers performing, even though they're not in a physical classroom. When they do online learning in this system, where you display different kids at the same time. And I saw that some of the online sessions, you may have to mute the other children, but they will still be singing their heart out because children don't,
Yes.
because the noise will, different lags will be there. So you may have to have just one child's song focused at a time, and then the rest are muted, but they wouldn't realize that because they still sing their heart out. They would be doing their action. So wheels on the bus go. So
Absolutely.
yeah. So I think there are some couple of questions which came on the screen.
There's
But
so what Preeti is saying, that at Wowkids, our live sessions primarily focuses on physical and mental exercises and social interaction, as we believe that children's are missing at home, that this is what they're missing at home. So as I told you, Dr. Sridhar, before the call, so the session that Wowkids we are doing, we do a 45 minutes to 1 hour of Zoom call with children, where it is a two-way communication. We don't just it's not a lecture, it's not a lecture of teaching, but we make them do some yoga, some physical exercises, some dance session. So what she is saying is that shouldn't it be done for older children too, like the grown-ups? Wouldn't
Yes.
children be more attentive and more receptive if online sessions are made fun, simple, and short? Now,
Exactly.
I can understand from where she's coming from, that we have seen, because we have children who are 8-year-old, where they are also learning online, where it's a very different way of teaching, which is completely focused on the lessons. There's no fun, there's no laughter. It is completely just open the book and start doing the work. So
we have two
and
groups here.
they're
We have
missing
the primary school. Yeah, we have the primary school kids and the secondary school kids. So we have to draw a line between them when we plan sessions. The whole of the primary school is a foundation period where they're not focused on as much learning as interaction. And they are the youngsters who are going to be distracted more easily. So the whole of the primary curriculum for online learning should be fun-based, should be limited in time. You allow some homework with the parents where you can have recorded sessions. So that gives you two advantages. One is all the sessions that you have online live is interactive. And the second part is it gives the parents the freedom of juggling around with their time. They can finish their work, they can focus on the child when they are most receptive to it. They can understand their child's moods and emotions. So they don't need to force a child to sit and study. So they can pick the child's mood. They've just had a nap, they've just had a snack, and then they're ready to study for half an hour, 45 minutes in a focused way. So it's the output and the quality of the input that matters rather than continuous sitting through. So this concept should be driven to the people who plan the online education for the whole of the primary school. After they enter secondary school, they are already they have been reasonably disciplined. They have learned a fair bit in school, and they can sit through lessons. And even in the physical school, they are not going to interact much with their peers when the class is going on, because they have reached a level of understanding where things are taught to them and they learn it. So secondary school is a different ball game. So I would say till 12 years of age, we have to plan this, and very important that we consider parents' plight as well when we make a plan. One of my classmates, who is now a grandparent, she's a young grandparent. So she was telling about the plight at home with 3 and 5-year-old grandchildren who refuse to sit with the online sessions. I mean, basically, there are countries like Netherlands, for example, where children don't start formal schooling till 6 years of age. So we don't really gain much by starting their schooling or education early, and that's why we shouldn't be assessing them in an active way. There are advantages of interacting with children, of learning these different aspects: communication, resilience, patience. So these are things which can be taught in a fun way. So we should remove targets from the curriculum. We should focus on what are the key aspects they need to learn. And this can be a long-term goal as well. I mean, obviously 1 or 2 years is a reasonably short term when you have to revamp the system quickly. So there is not much time. At least for the next school year, we should have this in plan. By say August or so, we should have a system in plan that would help that. I mean, I hope Atul can get this message out to other fellow educators in the country as well as the ministers, for example.
We already, in the beginning of pandemic, I will say last year in the month of March and April, we could imagine, we were then speculating that the schools will physically open by September last year, when the pandemic started. Nobody knew that there will be second wave, third wave, fourth wave, all that. So we one thing that we immediately decided is not to focus on completing the lessons, the curriculum, keep that aside. We really focused on the emotional, social and physical development of children, because we really realize that this is what is the need of the hour. And as you rightly said, one very important point, that consider the parent while planning this, because they will be working from home and working for home. They will be cooking, they will be doing all household chores, as well as they will be working from home. So there it has to be. And there is another challenge that we found initially, that there is just one laptop in the house that the father has. So he has to be online working for his office, as well as the child should be attending a class. So there were several other challenges, and mother is a teacher, so she also needs a device. So there were multiple challenges. So if you consider, and the best thing that we did is, for the first time, although we as preschool chain owners, we know what to teach, when to teach, how to teach our small children, but we partnered with parents because it was a need of the hour. We gave them options, that what would you like, will this work or will that work, will a 30 minutes class online work, along with some recorded sessions which you can see at your convenience and do it with your child. Yes, so we formally came up with a program which was formed by the partnership of parents, where majority of them, they said that, okay, if you give us recorded sessions, maybe whenever me or my husband will get time, we will do it with our child. So there were parents who were sending assignments late in the evening, because everybody was at home. So the whole routine has got changed. They get up late and they sleep late in the night. And so there were parents who were doing these lessons with the child at, say, 10 o'clock in the night or 11 o'clock in the night. So, but it was really helpful to make it considering their situation and what is going on with their lives. So that's very, very important for other educators. It's a big learning. It was a time when we just kept aside what we want, because the parent has to come into the role of the teacher. We can only guide them, but the child is with the parent. So we
There's
had
one important point again about the emotional stress, that the anxiety that the child gets from all this news they hear about the sickness around them.
I was about to talk to you about that. Yes.
Yeah.
Right. Please
So,
carry on, doctor.
that's something that we need to acknowledge, that it's a real fear, because they hear their friends talking, their siblings who are older might be already seeing the figures in the news and they might be panicking. So we have to explain to them. We shouldn't avoid the problem. We should explain to them what is happening. Again, this is a good opportunity to reinforce the importance of social distancing and how they can do their bit to avoid it spreading to other children or getting it from other children. So also reassuring them that like any other child who has any illness, that they will go through it successfully. If they do catch the infection, there may be a fear of dying, because that's been drilled so much from the news items they see or from their colleagues discussing or friends discussing. So we need to address it in a sympathetic way. We cannot wave it away that you will be fine. We have to acknowledge that they have a fear, and we should even acknowledge that we have a fear ourselves. So because we will be showing it in different places when we talk to other colleagues with children, will be observing as well. So we can't run away from such facts. I mean, we have to acknowledge their fear. We have to acknowledge their anxiety. We have to do our best to allay their anxiety, reassure them. We may have to involve them in the discussions that happen in the family. You may have financial crisis and you may need their support in reducing the overall expense in the family. You cannot have the same fun life you had before, and such things may need to be addressed as well. And you mentioned a very important thing about device sharing, and again, splitting the time would help that. And having there are many tablets which are now much cheaper than what it used to be, so reasonably affordable. So rather than getting an additional stress of sharing a laptop, which is an important thing for the bread earner of the family, you can give the child a tablet which is a reasonable screen size. And one of the important messages here again is teaching the child to regularly blink and not continuously stare, because we get lots of dry eyes, and not to keep the headphones volume very high. I mean, the parents, you may have a small house where you don't have different rooms, so you may need headphones. You cannot say use the volume without the headphone, but you have to monitor what volume the child is keeping and restrict it. I mean, you have to educate them that their hearing will be damaged in the long run. So continuous staring or frequent staring at a screen without blinking will cause a dry eye. So that's important to say. Ergonomics, how they sit during the lessons, because we see back pain, neck pain. So it's very important to guide them on that aspect as well. And headphone volume is very important. Teaching them to share the devices with their sibling. I mean, that's part of teaching them to share and communicate with each other in a reasonable way. Again, staggering the times, giving them times which they can choose, and having more recorded sessions and live sessions focusing only on interaction would reduce that problem as well.
So one more question which has come up, Preeti is saying, so there are a lot of parents who want to substitute TV or mobile. You know, they are okay with the child spending the whole day in front of the television or mobile, but they're not okay with the online teaching. They said, no. We don't want to go on a Zoom class, but they are okay with YouTube or, TV, watching TV. Parents feel showing videos on YouTube will give them the same learning and it's free. What do you suggest for them?
I mean, it's not a question of free or charged. I mean, obviously, all of us are doing much more than what we normally do for sake of
here,
development.
the whole idea is that when in a online session, say Zoom, the teacher is talking to the child. It's a two-way interaction.
Coming to that, I mean, one point is obviously you have a planned education. I mean, what I was trying to say is whether it is free or not, it should be structured. I mean, I was trying to say that even people like you would be offering free sessions. I heard that other educational apps which are giving free sessions to the families, because everyone is going through financial stress now. So it's about choosing the right aspect which will give them the right experience. So a plan, mind has been put into thinking about what the child needs to learn, focus on that, because they have a limited attention span. And remember that YouTube or anything for that matter should not be given to a free hand to the children, because there is so much information available. They will be so easily distracted because YouTube gives a playlist right next to you, and the next video will be someone dancing. The child will immediately go on to that. So it's very difficult to distract them and keep them focused.
You're right. I completely agree.
So structured approach is very important. I mean, someone who is involving an educator in early child education is very important, and you shouldn't be distracted. I mean, you are making life more difficult, because one of the reasons we want screen time to be limited is because children who are watching too much screen time become difficult to handle. They will have
Yeah.
reduced attention span, they will tantrum more, and they communicate poorly. So because they can't express, they are not used to two-way communication. So when the teacher plans an interactive session, that should be the goal that we take part. And a structured education for your child's exact age group is key. So if you can find that program online, BBC website or any other educational websites, you can do that, but it should be under supervision. And I think organizations like yours could give them links to free educational tools as well in between the paid sessions.
Right. So there, another question that I wanted to ask you about, which you've already answered in a very big manner. That what do you suggest are the best options parents for social and emotional development of children? So you've already answered a lot of advices that you've given to parents. So I'll just skip that. So doctor, what is your message for parents and adults to deal with this pandemic? I'm sure the guards are on, but a lot of people are just not understanding. I'm quite afraid why it is happening, that second wave, third wave is still going wild. So what is your message for the parents and the adults, how to deal with this pandemic? Where do you see this going? You've already told about vaccination. Still there are a lot of reservations. A lot of people just don't want to take it because they only want to hear the wrong news, the wrong information. What is your advice for the adults who are watching, being a doctor, on this pandemic?
I mean, unfortunately, the time frame that we are talking of is not limited, because we have seen nearly 1 year and a few months now, and it's only becoming worse. The virus is mutating, and that's the reason we are getting new waves. People are lowering their guard, no doubt about it. I mean, even in India, when we had that dip till last month, I mean, we were complacent, and unfortunately, the mood has changed. Now the peak has hit us so badly that people are not able to react quick enough. So complacence has to be avoided. Feel free to tell others that they need to do what they need to do. I mean, you may be following the precautions, but if your neighbor is not doing it, you may have to tell them in a gentle way or even in a strong way. I mean, it's not about complaining to the authorities, because the same thing may happen to you the next day. It's about telling them the importance of being cautious. Avoid spreading rumors. Don't share any messages which can lead to false messages. I mean, unfortunately, we had the demise of the popular actor in Tamil cinema, Vivek, and he took the vaccines. He went very important public message for parents and people to take the vaccines, but unfortunately, he had a heart attack the very next day, and people are
actually miscommunicating and mixing it that, oh, he got a heart attack because of the vaccine, which is very wrong. People are not
very wrong. So that's why the
wrong information. Yes.
Yeah, we should never spread wrong messages when it comes to very serious issues like this, because already we are facing shortage with the vaccines, because people are suddenly realizing vaccines need to be taken. Whether the government could have planned it better, we could debate that, but obviously that's not the aim. We should aim at improving things ourselves, being responsible. Take the vaccine when it is available to you without refusing it, and don't send wrong messages across. And of course, be aware of the stress that is happening around you for your own family's welfare. Reduce the stress, because stress affects your immunity as well. And how you fight an infection, it depends on how rested you are, how much exercise you have. Don't ignore physical activity. Don't ignore healthy eating. Don't ignore your child's welfare as well.
Doctor, one more question which I had, maybe I thought I'll just ask you, because some information we heard about the vaccine for children. So will there be a vaccine for children? Is it an urgent requirement, or it will take some time? Let it be. What is the age group which should?
So obviously the adult vaccine is, yeah.
Please carry on.
The adult vaccine has been developed in a rapid way. As you know, this is one of the fastest vaccines that has been introduced, and not only one vaccine, there are multiple vaccines that have been produced. A rapid testing phase has been done. The reason they could do it is because of the the genomics has been deciphered so quickly and the genetics field has developed, so we can actually get the RNA structure of the virus in no time, and then we can prepare vector vaccines and inactivated vaccines and so on in a rapid way. We have different styles of vaccines. For the first time, the Pfizer vaccine or the Moderna vaccines have never been tried in humans before, the types of the RNA vaccines, but they have been used in millions of people and have been shown to be fairly safe. Even the side effects, the blood clots happening in 40 patients out of 16 million is a very small number, but because of the rapidity which they introduce, they are holding and checking the facts and so on before they bring it again. But you shouldn't be worried about any type of vaccine which has gone through millions of patients already. There are the odd events that happen in people, and it may happen in the vaccinated people, as in the example I told you. These are not adverse effects of the vaccine necessarily, so please don't avoid taking the vaccine, because the vaccine does prepare you for that. In children, there are studies going on in the US for 12 years to 18 years with the Pfizer and the Moderna and even the Johnson vaccine, which currently is on hold briefly. But we also have plans for the pregnant women, breastfeeding women are being tested. In the US, they are being given the vaccine and being monitored as well. So that's one group, because the pregnant woman getting it would give antibodies for the infant in the first year. Younger kids below 12 years may not be tested immediately, but once we know the 12 to 18-year age group is reacting well, I think it should just be a matter of extrapolation of the data and further testing. So we should be seeing vaccines in children in the next year or so.
Okay. So, but we don't. There is no urgency to make that vaccine. I'm sure adult population needs to be vaccinated much more. And strange, I was just seeing the information that almost 65 to 70% of adults who are getting infected and getting hospitalized are below 45 years of age this time in this second
Yes.
wave. That is what the data shows. So which in fact indirectly tells that a lot of senior citizens above one, people who have
Yes.
bigger age groups are fine.
They are
They're not
protected by the
getting
vaccine
that vaccinated because they have taken a vaccine. Now there is one more thing that people, my friend, because I have taken the first dose of the AstraZeneca vaccine, and I was just talking to some of my friends, and they have this mindset, and they're asking this question: oh, there are so many cases where the people have taken a vaccine and they have still got infected. So where we just, everybody's trying to tell them that no vaccine guarantees that you will not get infected. It's only that you will have antibodies and will have less symptoms. So what is your say to these the people who are still reluctant? They feel that, oh no, still I may get, I have a blood pressure problem, I'm a diabetic, and if I take a vaccine, it may go worse. And we are seeing that people who are taking a vaccine, still they are getting infected. So what is your message to these people?
I mean, to be honest, you should be aware of what a vaccine can do and cannot do. And very important to understand that you need to take both doses, and you need a couple of weeks after the second dose for the vaccine to really be protective enough. And when we say protective enough, we are targeting avoiding hospitalization, avoiding serious infection. If you do catch the virus, you can still spread it to others for a brief time. Even though the duration which you spread may be shortened, you may not shed as high a load as you would otherwise. So it may reduce the chances of your family members getting the infection if you are exposed. But remember that it's like wearing a helmet when you're riding a bike. It protects you from head injury, but it doesn't protect you from the accident. So you have to drive in a way that you don't get involved in an accident yourself. So even if you take the vaccine, you still have to follow the precautions, because the virus is not going to be prevented from getting into you. It will only prevent the way the body reacts to the virus after you get it. So virus still multiplies in you. We are not saying the vaccine will do magic. It will be a golden shield around you which will prevent the virus coming to you. It won't do that. It only avoids the virus causing a severe problem in you, because your immunity is channeled to react in a suitable way. So please take the vaccine and don't spread. I find these messages very irritating when they say, can you stop wearing a mask? Can you stop social distancing? It's not the aim of that. I mean, our aim is to prevent you from dying. So be responsible. Don't spread such messages, even though it may sound like a joke. some people may misconstrue it as a serious message, and they may avoid taking the vaccine because what's the point is ultimately a wrong message.
Right. Maryann, what are your views? How would we like to? I think it's been almost an hour. We generally conclude the session 45 minutes, but this information has been so important, and hearing it from a doctor, Dr. Sridhar, is really going to be beneficial for a lot of us. So, Maryann, anything that you would like to add to this conversation? We can conclude this today.
I believe so. Hearing it from a neonatologist is different than just hearing it from Dr. Fauci. You want to hear from somebody that actually specializes in children, and so that has an added benefit for this group in particular. And I think that it's important to the suggestions that he gives, providing the different types of education for parents to make choices, like some online and some live. And that's what we do with Music with Mayor, is we make sure that it's available in all the different ways. So hopefully people will understand and appreciate everything the doctor had to say, and to practice for their own personal use and needs. Appreciate you taking the time to talk to us.
Just a moment, Maryann. We have one question from Pushpa Rani, who is one of our partners. Doctor, as you told that the virus are not going to be disappeared, it's a long time disease. So how long we will have to go with online classes to preschools? What can be other alternatives for preschools, keeping safety in mind in India? What are your suggestions? So I think, Doctor, you've already covered that. See, what is she in one of the? There are several questions that she's written. One of this, that till when will this continue?
I mean, as you said, we covered it in the discussion, and obviously the importance is going to be in preparing. And preschools, it's not an alternative to preschool. We are considering how we can effectively restructure the way we run it in a safe way. So you have to reduce the numbers at any point in time in the preschool, so the teachers can have an eye on social distancing and other issues. They can have a protocol in place for what will happen if a child has fever or anyone in the family has exposure to COVID. And we should also keep in mind that we support the people who are running the early child education as well, because they are putting in a lot of effort to work through the pandemic themselves. They have their own setups to go, and they cannot suddenly bring it up again when the pandemic ends. So this is a very critical area where they support the families in normal times, and it's a responsibility of the families and the government to support them during these times in a way that will help the families as well. As I said, I pointed out the importance of some physical education for the families, and it's very important to merge it. We have to plan a curriculum which is viable. So I don't want to repeat the whole thing we repeated again, but just to keep in mind, it's a very important area to address. And the education system, the health minister, the education ministry, they should be involved in countrywide plan. And before we finish, I would like to again invite all of you to review the family-centric videos we have on my YouTube channel. You just have to enter the Sridhar K as it comes in the running text below, and you will find it on YouTube. They are focused on young kids, both managing a newborn baby or developing child. What are the important safety? Atul was mentioning about resuscitation and life support awareness, what to do if there is choking, what are the measures to take, why we shouldn't have screen time for family. So many such educational messages are there, and the aim is to create awareness and to spread it, and the more people you can share it, the better. Thank you.
Yes.
See, one thing to this question that Pushpa Rani had asked, I think what she's asking is that, okay, because we are in a very stressed condition when the preschools have been closed for the entire year, and suddenly this second wave is taking its toll, and it's going uncontrolled, and we don't know when it will reach the peak. So currently there is no other option but to go online and support the families and do whatever possible in a very restricted manner, because they're very small children. So maybe 1 hour of screen time and some recorded videos to carry on learning during this pandemic is the option for the current moment. But maybe say after 1 or 2 months down the line, when the cases start declining substantially once again, then a hybrid system will get started. I should get started in the manner that parents will be given an option that you want to do an online, please, you're welcome to attend online. If you want to send physically, then you have to send in small groups with all social distancing, all the masks up for the staff as well as teachers, all the hand hygiene, whatever needs to be done can be in place, and we can start in smaller groups.
Yes.
Okay, so that's something that is the alternative, keeping all the safety. And definitely, all the controls should be at the gate, that if the child is, you can see from the face of the child whether the child is absolutely fine, or the he is having fever or looks like a little drowsy. So any kind of illness, the child should not be allowed to attend the class. He should be at home with the family. So there are those kind of safety measures that somebody can, we all can meet. So that is something that we will communicate to everyone as the time goes. But at this moment, I think still the cases are increasing very high in our country, and we'll have to wait for some more time before they reach a peak and then start subsiding. What the government has been saying, that the way it is going up, the same way they should go down. I'm not sure there is what science are they referring it to, but we don't know how it's going to be. But yes, of course, the seeing the speed of vaccination every day, almost we are touching almost 30 lakhs vaccination a day, which is a positive sign. Suddenly, there was earlier, there were no people who were turning up for vaccination, and suddenly the vaccine is over at so many vaccination centers because the cases were growing. So everybody rushed. And now, another vaccine of Sputnik has been given a go ahead. So let's see how soon we can vaccinate more and more people. We are, in fact, everybody is behind the government to open up vaccination for say 30 plus now, but still there is a lot of population above 45 which needs to be vaccinated. So let's see how it goes through. All right, so we've had a great conversation. We've never had a conversation that long. It was so important at this hour. It was a need of the hour to have spoken about these important questions, especially related to children, how COVID has impacted their life. There are a lot of suggestions that Dr. Sridhar has given us, how to carry on learning, social and emotional development of children, what to discuss with them, how much should be discussed to them. There are a lot of information that we got today from Dr. Sridhar. Thank you so much, Doctor, for accepting our invitation to come on this show, especially on a Sunday when it's your family time. And we know that you make those whistling videos and you go out with your family in the evening. Thank you for giving us time and joining us. Thank you, Maryann, once again for joining us today. I also thank all the viewers on Facebook for taking your precious time out to watch the show. I hope you have a great day and happy weekend. Stay safe and keep your guards up. Take the vaccination, and let's meet again next week. Okay, bye bye. Thank you so much.
Thank you. Good night.
Thank you.
All right.